Don't assume nausea is just part of getting older. While nausea can have many harmless causes, it can also be associated with medical conditions that benefit from early evaluation and treatment. Today, we'll look at 15 important points that explain why persistent nausea after age 75 should never be ignored, and when it's time to seek medical advice. Point 1. It's common to blame food for nausea. However, if the symptom continues despite eating normally, another explanation may need to be considered. Point 2. Digestive conditions are another possibility. Problems such as acid reflux, constipation, or delayed stomach emptying can sometimes cause ongoing nausea. Point 3. Persistent nausea deserves attention, even if it's mild. A symptom doesn't have to be severe before it should be discussed with a healthcare professional. Point 4. One possible explanation is medication. Many prescription medicines, over-the-counter drugs, and even certain supplements can cause nausea as a side effect. Older adults are especially likely to take several medications each day, increasing the chance of side effects or drug interactions. Never stop taking a prescribed medication on your own. Instead, talk with your doctor or pharmacist if you think your medicine may be contributing to your symptoms. Point 5. Dehydration is another commonly overlooked cause of nausea. As people get older, the sensation of thirst often becomes weaker, making it easier to become mildly dehydrated without realizing it. Even a small loss of fluids can lead to nausea, dizziness, weakness, and confusion. Drinking enough water throughout the day is an important part of maintaining good health, especially during hot weather or illness. Point 6. Infections may also cause nausea. Even when classic symptoms are missing, older adults don't always develop a high fever or obvious signs of infection. Instead, they may experience nausea, fatigue, weakness, or a reduced appetite. Urinary tract infections and some respiratory infections can sometimes present this way, making it important to seek medical evaluation if these symptoms continue. Point 7. Persistent nausea can occasionally be linked to health conditions outside the digestive system. Problems affecting the kidneys, liver, heart, or other organs may sometimes include nausea as one of several symptoms. Nausea by itself does not identify the cause, but when it continues without explanation, a medical evaluation can help determine whether additional testing is needed. Point 8. Pay close attention to other symptoms that occur with nausea. Severe abdominal pain, chest pain, difficulty breathing, fainting, repeated vomiting, confusion, or vomiting blood should never be ignored. These symptoms require immediate medical attention because they may indicate a serious medical emergency. Point 9. Ongoing nausea often reduces appetite. Eating less than usual for several days can increase the risk of dehydration, weight loss, and poor nutrition, which may lead to weakness and slower recovery in older adults. Point 10. Keeping a simple symptom diary can be very helpful. Record when the nausea occurs, what you ate, what medications you took, and whether any other symptoms appeared. This information can make it easier for your healthcare provider to identify possible causes. Point 11. Don't assume persistent nausea is simply a normal part of aging. Although many conditions become more common with age, ongoing nausea itself is not considered a normal consequence of getting older. Point 12. If nausea continues for several days repeatedly, returns without an obvious cause, or makes it difficult to eat and drink normally, schedule an appointment with your healthcare provider. Early evaluation can often identify treatable conditions before they become more serious. Point 13. Seek emergency medical care immediately. If nausea is accompanied by chest pain, severe shortness of breath, sudden confusion, severe abdominal pain, repeated vomiting blood, black stools, or signs of severe dehydration, such as extreme weakness or very little urine, these symptoms should never be ignored. Point 14. Simple daily habits may help reduce the risk of nausea. Stay well hydrated, eat balanced meals, avoid skipping meals, take medications exactly as prescribed, and attend regular medical checkups. These habits support both digestive health and overall well-being. Point 15. The most important message is this: persistent nausea after age 75 deserves attention, not fear. In many cases, the cause is treatable, but finding the reason early is the best way to protect your health. Listening to your body and seeking medical advice when symptoms persist can make a meaningful difference in maintaining your quality of life. Another important factor to consider is blood sugar. In older adults, both very low and very high blood sugar levels can sometimes cause nausea, along with weakness, sweating, dizziness, or confusion. People living with diabetes should pay close attention to these symptoms and follow their healthcare providers' recommendations for monitoring and managing blood sugar levels. Point 17. Gallbladder and pancreatic conditions may also cause nausea, particularly after eating fatty meals. In some cases, nausea may be accompanied by pain in the upper abdomen that spreads to the back, fever, or vomiting. These symptoms should not be ignored, as they require prompt medical evaluation to determine the underlying cause. Point 18. Persistent nausea can gradually affect more than just your stomach. Over time, it may reduce your desire to eat, limit your daily activities, disturb your sleep, and contribute to muscle loss or increased frailty. Addressing the symptom early may help prevent these complications and support better overall health and independence. Point 19. If you're caring for an older family member, don't overlook subtle changes in their behavior. Someone experiencing ongoing nausea may simply eat less, avoid favorite foods, stay in bed more often, or say they just don't feel right. These small changes can be important clues that something deserves medical attention, even if the person doesn't complain about feeling sick. Point 20. Remember, nausea is your body's way of signaling that something may need attention. It is not a diagnosis by itself. While many causes are minor and treatable, persistent or unexplained nausea should always be evaluated by a healthcare professional, rather than ignored or treated with home remedies alone. Paying attention to this symptom and seeking timely medical advice can help identify problems early and support healthier aging. It's also important to pay attention to how often nausea occurs. A single episode that resolves quickly is very different from nausea that returns week after week. Recurring symptoms may indicate an underlying issue that has not been identified. Even if each episode seems mild, keeping track of the pattern and discussing it with your healthcare provider can help determine whether further evaluation is needed. Point 22. Some older adults try to manage ongoing nausea by eating very little or avoiding meals altogether. While this may seem like it helps temporarily, it can lead to poor nutrition, dehydration, and unintended weight loss over time. Instead of making major changes to your diet on your own, seek medical advice to identify the cause of the nausea and receive appropriate treatment if needed. Point 23. The best approach is to take persistent nausea seriously, without assuming the worst. Most cases are not medical emergencies, and many causes can be treated once they are identified. The key is recognizing when the symptom doesn't go away, continues to return, or is accompanied by other concerning signs. Seeking timely medical care gives you the best chance of finding the cause early and maintaining your health and independence as you age.